Trauma is an emotional response to a stressing event. The effect of trauma can be short-term, long-term, and sometimes even severe depending on the individual, as trauma affects everyone differently. Trauma is a feeling of being overwhelmed by the experience. Cases like natural disasters, death, abuse, rape, and assault are often common causes of trauma. Trauma can be classified as acute, chronic, and even complex, whereby acute trauma is a psychological trauma that is in response to a single event that causes distress. This particular type of trauma can lead to one developing acute stress disorder, which is a disorder that typically appears or occurs within 3 days of experiencing a traumatic event lasting to 1 month. When looking at chronic trauma, this is ongoing repeated traumatic event. This happens when a person is exposed to long-lasting, long-term tragedy, prolonged distressing traumatic event over extended period. Chronic trauma may result from things like sexual abuse, domestic violence, bullying, etc. Remember, these are not the only causes of chronic trauma. Chronic trauma may lead to a person developing post-traumatic stress disorder. The difference between acute and chronic trauma is that acute trauma is due to one-off single event, while as chronic trauma is due to ongoing repeated traumatic event. Let's move to complex trauma. When you're talking about complex trauma, we are talking about multi-layered trauma. It comes as a result of being exposed to different and multiple traumatic experiences. These events usually happen within the context of interpersonal relation, like a child being abused by their parents, leading to the child feeling trapped. Complex trauma is by far the most severe kind of trauma. It can lead to one developing complex post-traumatic stress disorder. Then there are a group of disorders that are called trauma-related disorders. These are a group of disorders that come as a result of one having suffered traumatic experiences. These disorders include PTSD, which is post-traumatic stress disorder, acute stress disorder, adjustment disorder, reactive attachment disorder, disinhibited social engagement disorder, and also unspecified trauma stressor-related disorders.